At some point, you've probably stared into a mirror and wondered, why this color? People will tell you it means you're calm, intense, mysterious. They'll swear they can read you from your iris. But your eye color is not a mood ring. It's a biological filter built from pigment and structure, and it leaves clues about how your eyes handle light and how to protect them. Before we start, subscribe so you don't miss the next step-by-step guide to eye and brain health. Here's the one question we're answering today. What can your eye color actually tell you, medically, beyond appearance? To keep this grounded, I'm going to use one model with 4 levers, and we'll reuse them the whole way. Lever 1 is pigment load. How much melanin, the brown-black pigment, sits in your iris. More pigment load means more light gets absorbed instead of bouncing around. Lever 2 is light physics, how your iris scatters or absorbs different wavelengths. This is why some eyes look blue without having blue pigment. Lever 3 is genetics and ancestry, the gene switches that control pigment load and how mixing over generations creates the spectrum you see today. I'm drawing from established vision genetics and a reference outline. Lever 4 is health trade-offs, how those first 3 levers change real risks like sun damage, inflammation, and certain eye diseases. The iris is the colored ring that controls pupil size. Its job is to meter light, like a camera aperture. The color comes from how much melanin is stored in the front layers of that tissue. High pigment load, usually brown, acts like a darker tint. It reduces glare, especially in bright sun, because light gets soaked up rather than scattered. Low pigment load, often blue or gray, lets more light bounce inside the iris. Light physics takes over. Shorter wavelengths scatter back toward you, creating that blue-gray look, similar to why the sky appears blue. I see a common pattern. Someone has vision on the chart, but office LEDs feel like sandpaper. Their exam is normal, their pigment load is low, and the scattering makes that light feel harsher. Here's a quick self-check. If you have lighter eyes and you feel washed out, teary, or headachy in bright daylight, that can be simple light sensitivity, not weak eyes. It's the filter being lighter. And here's an open loop we'll resolve later. When someone says their eye color changed, sometimes it's lighting, and sometimes it's a medical signal. We'll also correct the biggest social myth, that eye color can predict personality. Recap. Eye color reflects pigment load and light physics first, then genetics and ancestry. Blue eyes don't contain blue pigment. They contain less front layer melanin. When light enters, it scatters off collagen fibers and tiny structures in the iris, then bounces back out. Shorter wavelengths scatter more, so your brain reads blue. That's light physics, not a special dye. Blue and gray are relatives. Gray usually reflects a touch more pigment or different fiber density. Pupil size changes can make color seem to shift. Most people think blue eyes are weaker, but the real driver is glare management. With lower pigment load, more light ricochets inside the eye before it leaves. In full sun, that extra scatter can translate into squinting, watery eyes, or a low-grade headache. Here's your self-check. If you avoid sunny sidewalks or hate bright grocery stores, note it. It's not a character flaw. It's your filter. The highest leverage move is boring but powerful. Consistent UV and glare protection. Look for lenses labeled UV 400 and use a brimmed hat when you'll be outside for long stretches. Polarized lenses can cut reflected glare from roads and water, which is often the trigger, not brightness itself. And here's the consequence line. If UV exposure stays high for years, it pushes toward earlier lens clouding, called cataract and retinal wear. We'll come back to the risk question in Chapter 6, because the data is nuanced. Recap. Low pigment load increases scatter, so protection is about comfort and long-term exposure. Hazel and green eyes usually sit in the middle of pigment load. There's enough melanin to add brown and gold tones, but not enough to fully mask light physics. So you get a blend. Some light is absorbed, some is scattered, and your brain reads shifting shades. Most people think hazel eyes change with mood, but the real drivers are lighting, pupil size, and background colors. In bright light, the pupil tightens and you see more of the iris surface. Indoors, the pupil opens, and deeper layers influence what you notice. Here's a practical payoff. If your eyes look greener outdoors and browner indoors, that's normal optics, not a body signal. Now, why can hazel and green feel comfortable in many settings? They often balance glare control and light capture. But balance isn't a guarantee. Dryness, allergies, and screen exposure can still make any eye feel irritated. Try this self-check tonight. After 2 hours on a screen, do your eyes burn or blur, then clear after blinking? That points to tear film instability, meaning the surface is drying faster than it's refreshed. If surface dryness stays unchecked, it pushes toward inflammation and more frequent styes, those tender eyelid bumps. We'll use this in Chapter 5, when we talk about when color change is actually a warning. Recap. Hazel and green reflect mid-pigment load plus light physics, often shifting with light. Brown eyes usually mean higher pigment load in the iris. More melanin sits in front layers, absorbing stray light. That often means less glare and less washed-out feeling outdoors. It's like having a built-in tint, but it's still a living tissue. Most people think brown eyes can't be light-sensitive, but light physics still applies. A bright, flickering environment can overwhelm anyone, especially with migraine, concussion history, or dry eye. Here's a useful self-check. Do you get headaches under fluorescent lights even with sunglasses? If yes, the driver may be flicker sensitivity or migraine wiring, not eye color. Now, the health trade-offs. Higher pigment load may reduce some UV-driven stress, but it does not eliminate it. UV still reaches the lens and the retina. Long exposure without protection pushes toward cataract, and it can worsen surface irritation. This is also where genetics and ancestry matters. Eye color clusters with skin tone in many families, and that can change how sun affects the whole eye area. But genetics are mixed. You can have brown eyes and very fair skin. One more open loop. Those small brown specks people call eye freckles. Some are harmless pigment spots. Some need monitoring, especially if they grow or distort the iris pattern. Recap. High pigment load often reduces glare, but health trade-offs still depend on exposure and habits. First, normal change happens in 2 common ways. Babies can be born with lighter eyes because melanin builds after birth. And adults can look different day to day because pupil size shifts, changing how much iris surface you notice. But there are changes I never want you to ignore. A sudden color shift in one eye, new speckling that wasn't there, or a ring at the edge that seems to appear quickly. Here's the clinical reason. The iris can lose or gain pigment, or it can swell. Inflammation inside the eye, called uveitis, means the immune system is irritated in the iris and nearby tissues. It can change light reflection, and it can raise eye pressure. A common pattern I see is someone who says, "My right eye looks lighter." When we check, there's subtle redness, light sensitivity, and a slightly smaller pupil. That combination can point to inflammation or a nerve signal change, not a mirror trick. Medication can also shift color. Some glaucoma drops, called prostaglandin analogs, can slowly darken the iris in lighter eyes. Quick self-check. Compare both eyes in the same bathroom light once a month. If the difference is new, or there's pain, blur, halos, or nausea, get urgent care. If inflammation stays active, it pushes towards scar tissue, cataract, and pressure damage. Recap. Day-to-day shifts are optics, but one eye rapid change deserves a real exam. Let's close the open loop about eye freckles. Many are iris nevi, meaning a small cluster of pigment cells. Some are flat specks, some are a slightly raised spot. On their own, they're often harmless, but they should be documented. Your first job is pattern recognition, not panic. Concerning changes include growth over months, a new irregular edge, a bump that distorts the pupil, bleeding, or a sudden change in vision. If you've never had a baseline eye exam as an adult, this is a good reason. A dilated exam means we use drops to widen the pupil, then inspect the iris, lens, and retina. Now the risk question from Chapter 2. Some research links lighter eye color to higher odds of uveal melanoma, a rare cancer inside the eye. The likely pathway is health trade-offs. Lower pigment load absorbs less UV and high-energy visible light. But genetics and ancestry complicate the story, because eye color tracks with other inherited traits and sun exposure patterns. A realistic clinic snapshot. Someone notices a new brown dot after a beach season. We photograph it, measure it, and follow it. Most are stable. The win is catching the small minority that isn't. Here's the consequence line. If a growing lesion is ignored, it pushes toward later, harder treatment. Action steps are simple. Wear UV-blocking sunglasses, even on cloudy days. Use a hat for long outdoor time. And if you see a new spot in one eye, book an eye exam within weeks. One more open loop for Chapter 7. Why night driving can feel worse for some eye colors. Recap. Pigment load shapes light absorption, and health trade-offs depend on genes, exposure, and monitoring. At night, everyone's pupils widen to capture more light. A larger pupil also lets in more stray light from the edges of the cornea and lens. If your eye has even a small focusing error, that extra light can smear into glare. With lower pigment load, there can be more internal scatter, so bright headlights feel like they bloom. With higher pigment load, you may still struggle if the lens is starting to cloud or if the surface is dry. Dry eye means the tear film is uneven. That uneven film acts like a wavy windshield, bending light unpredictably. That is why blinking can temporarily sharpen things. Self-check. On a night drive, do halos shrink for a few seconds after a slow blink? If yes, treat the surface first. Take screen breaks, hydrate, and consider preservative-free artificial tears before driving. Also, check your prescription. Even a mild astigmatism, meaning the cornea is shaped more like a football than a basketball, can turn points of light into streaks. One more step most people miss. Clean the inside of your windshield and your glasses. A thin film creates extra scatter. Here's the consequence line. If night glare is worsening steadily, it pushes toward cataract or uncontrolled eye pressure. If the glare is sudden, one-sided, or paired with pain or nausea, don't wait. Get urgent evaluation. Recap. Night glare is pupil size plus surface quality, with pigment load shaping how scatter feels. If I had to translate eye color into something useful, it's this. Your iris is telling us how you handle light, and what to watch over time. Start with pigment load. Lighter eyes usually need more deliberate glare control. Darker eyes usually tolerate glare better but still need UV protection. Then, light physics. If your eyes scatter more light, comfort tools matter more. Polarized lenses, hats, and avoiding direct midday glare are not vanity. They're symptom control. Next, genetics and ancestry. Eye color is a clue to your family's pigment patterns, not a diagnosis. What matters more is your personal history, family glaucoma, early cataracts, autoimmune disease, severe allergies, or a melanoma history. Those override eye color. Finally, health trade-offs. This is where eye color becomes a risk conversation. Lighter eyes may have slightly higher vulnerability to light-driven damage, while any color can develop inflammation, pressure problems, or surface disease. Here's a simple checklist you can actually use. 1. Protect. Sunglasses with UV 400, plus a hat for long outdoor time. 2. Lubricate. If you use screens, treat dryness early. Blink breaks every 20 minutes, and tears if symptoms persist. 3. Monitor. Baseline dilated eye exam in adulthood, then follow your clinician's interval. 4. React fast to red flags. One eye color change, pain, sudden blur, halos, or nausea is urgent. Most people think eye color is a personal label, but it's really an engineering setting, and that means you can work with it. If you do nothing else after this video, do this. Choose one pair of true UV-blocking sunglasses and use them daily. Recap. Eye color mainly reflects pigment load and light physics. with genetics shaping your health trade-offs. Your eye color mostly tells me how your iris filters light, not your personality. It comes down to pigment load, light physics, genetics, and ancestry, and the health trade-offs they create. Highest leverage next step. Choose UV 400 sunglasses that fit and wear them every day outdoors. If you have lighter eyes, add a brimmed hat and consider polarized lenses for road and water glare. If you have darker eyes, don't skip protection. Damage adds up quietly. If one eye suddenly looks different, or you get pain, blur, halos, or nausea, get urgent care. Use the biology as a guide, and let the myths go. Next video question. How do screens and dry eye change vision over time? If this helped, like the video so you don't miss the next guide. Disclaimer. This is education only, not personal medical advice. Talk to your clinician, especially for sudden symptoms or one-eye changes. Seek care sooner with redness, light sensitivity, or sudden vision loss.